Hello, my name is Ivanka Hakis, and I'm going to be evaluating the study called Effects of Cannabidiol on Drop Seizures in the Lennox-Gastaut syndrome. So to start off with, a few key background information points. Cannabis is composed of THC and CBD, CBD being the medicinal component, and THC being the one that causes a high effect. Cannabidiol has been used in the past for individuals that suffer from epilepsy or Parkinson's disease that are still experiencing symptoms with their current medications. In the past, we've seen this cannabidiol being used in children with Dravet syndrome and how that's really shown improvement for them. Also, like Dravet syndrome, Lennox-Gastaut syndrome is an epileptic syndrome that affects children primarily beginning when below the age of 8. And currently for that syndrome, there's only 6 medications approved. However, the patients are still experiencing seizures even with those medications. So the purpose of this study was to investigate the efficacy and the safety of cannabidiol in addition to conventional anti-epileptic medication regimens. They included those people with, of course, the syndrome, which is characterized by a slow spike and wave complex measured by an EEG, and they had to have had at least 2 types of drop seizures with at least 6 months, for at least 6 months. They had to have had either atonic or tonic-clonic seizures, which would eventually cause them to have a fall. They included people from ages 2 to 55 years old, and then they had to have had also they had to have been taking also at least 1 to 4 anti-epileptic medications. They also had to have been stable for 4 weeks before screening and throughout the trial on those medications. They had to have had at least 2 drop seizures each week during baseline period. They didn't want individuals, however, who were unstable on medical conditions 4 weeks before screening. They also didn't want people who had a history of alcohol or substance abuse, who had a history of recreational or medicinal cannabis, who had used corticotropins, or who had used felbamate. So felbamate would cause very, very serious side effects, liver side effects. And then corticotropins, if used with CBD, has been shown to have a higher rate of level in the bloodstream, and then also decreased elimination. So they didn't want them to interact with the CBD, of course, that they were going to be administering in the trial. And then they didn't want to progress any adverse effects. For the methods, they went ahead and recruited patients for 6 months, from June 8 to December 15, in the years of 2015. Total eligible patients, they had 298, however, for the trial, they only had 225. This is a phase 3 trial. This trial is one of 4 trials. That's why the numbers here are kind of low for a phase 3, but it's because this is only one trial out of 4 that they did. This trial was randomized, double-blinded, and placebo-controlled. They used a computer-generated block randomization method. They used blocks of 6, and then they used a voice response or web-based response system to assign the patients to their groups. They had 3 trial groups. They had the 20 milligram cannabidiol group, then they had the 10 milligram cannabidiol group, and then they had their respective placebo groups. They had 30 participating centers. We can see here that they had 20 centers in the US, and then they also used Spain, United Kingdom, and France. But 20 centers were in the US. They had the most centers. This trial composed of a 24-week trial. They had a 4-week baseline period. They had a 14-week treatment period, which consisted of 2-week dose escalation and 12-week maintenance period. For the 2-week dose escalation, they started them on 2.5 milligrams, and then they increased it to 5 milligrams, and then every other day until their target dose was reached, meaning until they reached either the 10 milligrams or the 20 milligrams. Then they stayed on that maintenance period for 12 weeks, and then they had a 10-day max taper period, and